Okay, I think we will just start. Is that okay?
Yep.
Okay, wonderful. Okay, assalamu alaikum. A very good evening to all of our patrons. My name is Dr. Akhtar, and I would like to thank you for tuning in to another webinar by Pakistan Children's Heart Foundation. Today's topic is saving a human life, the virtues of heart transplantation. We are honored to welcome another prolific expert for our discussion today. Dr. Farhan Zafar is a surgeon by training and an associate professor in the Division of Cardiothoracic Surgery at Cincinnati Children's Hospital Medical Center. He is the director of Thoracic Organ Procurement and a member of the heart and lung transplant team at the hospital. He is a prolific researcher on the topic of thoracic transplantation and the mechanical assist devices for children and heads a NIH-funded research team. His research interests include methods to improve the impact of thoracic transplantation in children and novel heart valve therapies for children, among others. Welcome, Dr. Zafar.
Thank you, Dr. Akhtar, for a very kind introduction. And a special thank you to you and Farhan Ahmed for giving me the opportunity to speak to this forum about heart transplantation. I actually learned about PCHF 3 years ago when I met Farhan and was blown away by the impact of this organization on the lives of children with congenital heart disease in Pakistan. Then almost two months ago, I had the opportunity to see him again. And I discovered that Farhan Bhai and I share much more than a common name. And one of the things is a mutual interest in heart transplantation and its availability for patients in Pakistan. And that's when we decided to start this conversation. And this is exactly what this is, just the start of a conversation. So it is such a broad topic, but today I wanted to touch on a few aspects of this to begin this journey. And I will cover a brief introduction to organ transplantation, just to familiarize ourselves with some terms, and then a history of heart transplantation, how it began around the world, the process as it happens in the United States for heart transplantation, then a story of a heart transplant patient from my center, and then I will go into the state of heart transplantation globally, then in Asia, in the Muslim world, and lastly in the South Asia, where relative to Pakistan. And then I will talk about heart transplant outcomes very briefly compared to other organ transplantation, and in the end, describe the need for this in Pakistan. So to begin, there are different types of transplants: solid organ transplantation, which we will be talking about today, and it includes heart, lung, liver, kidney, pancreas, and small bowel transplantation. Then there is tissue transplantation, which you may have heard of in cornea, skin, and other tissue transplants. And then there is a bone marrow transplantation. Then there are different types of grafts: allografts, where donor and recipient are from the same species, which we'll be talking about mostly, and that's the most common transplant performed. Then there is xenograft, where the donor and recipient are from different species. These transplants are not as common. However, when a heart transplant was started back in 1960s, and I'll go over that in much more detail later, that's how it started. It started with a animal organ being transplanted in a human. However, there are significant challenges with that type of graft, and that's why it is not a common graft option. Then there are different types of donors: a living donor, which we are most familiar with in Pakistan, and a few organs can be transplanted using living donors, most commonly kidney and liver. Then there is deceased donor transplantation, which could be a donation after brain death or donation after cardiac death. A deceased donor can offer up to 8 organs and save that many lives. Just to give you a sense, in 2018, there were over 17,000 donors in the United States, and majority of them were deceased donors. To give a sense of numbers of transplants in the United States, just in 2018, 1 year, there were over 36,000 solid organ transplants performed. Over 30 or around 3,500 of them were heart transplants. And despite that many transplants, over 100,000 patients were waiting on the list at the end of that year. 95% of the US in a survey supports organ donation, but only 58% are registered donors. And just to give you a sense of what deceased organ donation is, only 3 people in 1,000 that die in such a way that organs can be donated for solid organ transplantation. So now to the history of heart transplantation. It actually began in early 1900s, but the real transplant as we know today, orthotopic transplant, where a recipient heart is taken out and a donor heart is placed in place of that recipient heart. That started in 1963 with James Hardy doing the first xenotransplant, where a chimpanzee heart was implanted in a patient. However, that only survived for a couple hours and the patient expired. In 1967, Christian Bernard from South Africa actually did the first orthotopic transplant with an allograft. A donor heart from a patient, from a deceased patient, was placed into a recipient. And that patient survived close to 17 or 18 days. Soon after, the first heart transplant was reported from Brazil by Dr. Zerbini. Then in the same year, Dr. Wada in Japan did another heart transplant, successful heart transplant. This just shows that how this therapy moved across borders in different countries very rapidly. And the hallmark or milestone in Japan is very significant because that happened in 1968. However, there has been no transplants, heart transplants reported from Japan in the last 2 decades at least. And the reasons are ethical and cultural issues relative to that country. Then in 1968, Dr. Norman Shumway did the first retransplant, where a previously transplanted patients received another heart transplant. Then comes cyclosporin, a drug that was labeled as a game changer for transplant in general, but also for heart transplant. And that really began the modern era of heart transplantation. Another milestone was in 1973, when a distant heart procurement was performed, where the donor and recipients were farther apart in terms of centers, and an organ had to travel to get to the recipient. And that's what we do in the modern day transplantation. In 1981, a combined heart-lung transplant was performed for the first time by Dr. Norman Shumway and Dr. Bruce Reeds in the United States. In US, in 1984, they passed a National Organ Transplant Act into law. And that's when, and since then, the organ donation is regulated by the US government. In 1984, and this milestone is much more close to my heart, is Dr. Denton Cooley did the first heart transplant in an infant, successful heart transplant in an infant. And then pediatric heart transplant became much more common after that. Just recently, in 2019, in the United States, the number of heart transplants performed crossed a major milestone of 100,000 transplants. So on to the process of heart transplantation. It all starts with a donor becoming available and a diagnosis of brain death is made at a hospital. This is a very important and often a controversial topic. So I'll take a few moments to describe what brain death is. Again, brain death is irreversible loss of all functions of the brain. Essential functions in brain death are Essential findings in brain death are coma, absence of brainstem reflexes, and apnea. Again, brain death is not just coma, but it is beyond coma where you have absence of all brainstem reflexes and also apnea. A patient is determined to be brain dead. Determined to be brain dead is legally and clinically dead, at least in the United States. Diagnosis of brain death is primarily clinical. So once the diagnosis is made, the deceased is referred to a nearby organ procurement organization, and there are 63 OPOs in the United States. And they start the process, which includes family discussion in death. Again, many citizens have clearly expressed that they want to be organ donors on their IDs. But in the event that they die, however, this does not automatically assign consent in all cases, and a consent is always requested from the family if available. Once a consent is completed, a medical evaluation is performed by the OPO, and a specific donor management begins. A formal matching process is then followed, where multiple candidates are offered this donor based on a priority list. And once a match is made, a recovery team procures the respective organs and then travels. Travel is different for different organs. Heart, for example, requires urgent transplantation because it cannot sustain longer times outside of blood circulation, referred to as ischemic time. Therefore, hearts often require a jet to be transported in the distance if the distance is longer than 2 hours by ground transportation. And heart, when arrive at the recipient hospital, recipients are already prepared for implantation, and an implantation procedure is done. I wanted to share a story of a patient with congenital heart disease that was transplanted at our Cincinnati Children's Hospital.
Hi, my name is Age Warren and I'm 11 years old.
I'm Dawn Warner.
When I was little, I was diagnosed with 2 heart defects.
She had coarctation of the aorta and multiple VSDs. Instead of patching the holes in her heart, he put a band around her pulmonary artery to control blood flow. She was about a month old before we got to bring her home the first time. And she did well for about 4 months. And then during routine checkup, they noticed that the band was starting to slip, so they had to go ahead and schedule the second surgery. It turned out to be a lot more complicated than they thought it was going to be. And by the time this was all said and done, they get her out of surgery. Her heart was not functioning, could not function on its own anymore. They had to put her on a temporary pacemaker. And then that evening, she came down with a horribly high fever. It turned out that she had contracted the MRSA bacteria. They waited a week thinking that maybe her heart would start beating on its own. After giving it a week and that didn't happen, they realized they were going to have to implant a permanent pacemaker. Finally, they were able to do the surgery, put in her pacemaker. That surgery just seemed to go so well. She was in and out in no time. But that afternoon, I was holding her and she aspirated and went into cardiac and respiratory arrest. That was probably the first time that I really realized that we might lose her.
Eventually, when I got older, I got a third undiagnosed that caused me to need a heart transplant.
And they told us that without a heart transplant, she was going to die. I had gone home for the evening and I received a phone call telling me that they were having trouble stabilizing her blood pressure. I knew this time there were only 2 ways she was coming off. You know, she either got a heart or she didn't. The doctor stepped back and let me pick her up and hold her one last time before I laid her down and they intubated her.
It came on my first birthday and I got it the next morning. It was from a 1-month-old baby boy, Cole Hollenbach. He was home with a babysitter and he suffocated in his crib. The doctors were suggesting that they just take him off everything and let him die, but the parents said, no, we're not going to let him die for nothing. He's going to be a hero.
And then on the evening of her first birthday, a family in Iowa lost their little boy. The decision they made, I can't even imagine how difficult it must have been.
I love him like a little brother. 11 years ago, I was this close to being dead, and now I'm playing soccer, like perfectly fine, like nothing ever happened.
She's my hero. She's the strongest little girl I've ever met. She has been since she was 3.5 pounds. And she has taught me what is really and truly important.
So yeah, it impacts lives in very significant ways. So now, what is the state of heart transplantation across the globe? There is an International Society of Heart and Lung Transplantation that gathers data on transplants performed globally. According to their statistics, over 20 countries perform transplants routinely and have an established system, which represents a total of around 400 individual transplant centers. In terms of Asia, ISHLT estimates that around a third of heart transplant activity in Asia is not reported to ISHLT. Therefore, actual activity level is harder to account for. But they list these 6 countries that have at least one center and have reported data to their registry. When we look at the literature, at least 13 Asian countries have some report of heart transplant activity. There's generally a trend towards an increase in number of heart transplants, mainly due to implementation of legislation for organ donation in those countries. Most of the heart transplants in Asia are done in Taiwan and Korea. And survival at 1, 5, and 10 years after heart transplant is similar to that in Western countries. In terms of history, the first heart transplant, as I stated earlier, was performed in Japan in 1968 in terms of Asia. And then the first heart transplant era began in Taiwan and Thailand in 1987, soon after the law was passed in the United States. In terms of heart transplantation in the Muslim world, in Turkey, the first heart transplant report comes from 1968. A study in 2015 showed that heart transplant number reached 60 per year in 2015. In Saudi Arabia, the first transplant report was from 1986. And by the end of 2016, a total of close to 350 transplants were performed in the Saudi Arabia. In 1993, Iran started doing heart transplants, and they have reported 90 transplants since 1993. Similarly, in Malaysia, the reports for heart transplant came from as early as 1997, and some reports suggest that there are over 20 transplants performed in that country. And more recently, UAE have started doing heart transplants, and as of July 2021, a total of 10 heart transplants have been performed in that country as well. So interestingly, there were 2 studies performed in the Gulf region a decade ago, a decade apart, and captured a change in attitudes towards transplantation. In 2005, over 60% of the study participants did not agree with donating organs, dead or alive. However, in 2017, a study showed over 80% were willing to donate an organ after death for a relative, and in fact, over 70% to even a non-relative. So there has been a significant change in attitude in other countries over time. And then let's talk about India. They have established a few robust programs over the years and that perform heart transplant. Their average heart transplant rate is 0.2 per million population, which in comparison to the world, it's around 1 per million population. They have implemented a law that accepts brain death as a form of death in 1994. and their first transplant was reported from August 1994. They have reported some of the earlier challenges, and which may sound familiar, but they were due to lack of investment from the government to promote the relatively new concept of brainstem death, and general lack of interest from leading transplant clinicians, lack of awareness among the medical professionals as well as in the general public. From 1995 to 2000, there were only 33 hospitals which had taken up the deceased donation program, and only 4 hospitals had started the heart transplant program in that country. They actually also started an organ sharing, an NGO organ sharing network called Mohan. And since then, they have seen a steady increase in their number of organ donations. Similarly, their number of transplants has grown over time. Let's talk about outcomes. Heart transplant has similar or better outcomes compared to all other solid organ transplants. In fact, when we compare adult to pediatric transplants, heart transplant in pediatrics offers significantly better outcomes. In adults, heart transplant quadruples the survival from a median of 2.4 years for those who need a heart transplant to almost 10 years for those who receive it. So it's 4 times more likely to, 4 times increase in their survival after transplant. And in pediatric patients, the median survival is even higher. It's close to 13 years. I mean, and by some reports is much higher, more in the more recent era. So now talking about the need, in adults, around 90% of transplants are performed for cardiomyopathy, ischemic or non-ischemic. Whereas in kids, majority of transplants are performed for congenital heart disease. So this is just to show what is the state of cardiovascular disease is in Pakistan. And it won't come as a surprise to this audience is that we have one of the highest age standardized death rate associated with cardiovascular disease compared to other countries. And in terms of congenital heart disease, once again, this audience probably know this, is that congenital cardiac anomalies in Pakistani population is more than double compared to rest of the world or non-Asian population. Similarly, data from global disease burden study showed that mortality associated with congenital heart disease per 100,000 infants was among the highest in Pakistan compared to the rest of the world. Another way to look at this is for our region, the prevalence of congenital heart disease per 100,000 population is around the same as some of the Western countries, despite the underdiagnosis of this problem. The prevalence of this disease is comparable to the Western world where heart transplant is commonly used. However, the mortality is significantly higher compared to these countries. In the end, I wanted to touch on a study that from Middle East shared their challenges in terms of establishment of an advanced heart failure and transplant program. And the major themes from that report